Well, tēnā koutou katoa, ko Monique Bradley, tōku ingoa, I'm Monique Bradley, and welcome to our first Facebook Live session as part of Diabetes Action Month 2023. With diabetes being the leading cause of blindness in Aotearoa, New Zealand, and loss of sight, a complication not widely known to be connected to this condition, our theme this year for this amazing campaign is Eyes on Diabetes. Regular eye checks, of course, and good blood glucose management is really crucially important when it comes to early detection, prevention, or even saving the sight of many New Zealanders living with diabetes. So tonight, we're going to be part of a massive conversation, us here in the studio and you here online. We're going to talk you through what you need to know, and we have a panel of experts here in our studio tonight to answer your questions as well. I have a computer set up beside me, so if you do have questions, send them on through, and I'll do my very best to send those questions to the expert who needs to hear them. So this is the first of our 2 Facebook Lives this month, and while tonight we're dialing in and looking at everything related to eye health, the second Facebook Live will be on what does diabetes self-care look like, also an extremely important topic. So make sure that you lock in the next Facebook Live. That's coming up on the 21st of November 2023. Lock it in your calendars now. So tonight is an interactive session, and I am excited because I have experts in the studio on the couch. Tonight I am joined by 3 experts, in fact. Over on our couch tonight, we have Philip Walsh from Specsavers. Welcome to the studio.
Thank you very much, honey.
We have ophthalmologist Dr. David Squirrel. Thank you so much for joining us. And we have, I want to call you a frequent flyer, Liz, because you've been part of many of our broadcasts, Liz Dutton, Head of Clinical Services at Diabetes New Zealand. Kia ora.
Kia ora.
Lovely to have you all here. Well, let me talk about tonight's topic. Tonight's topic is looking at how diabetes can affect your eyesight, the symptoms to look out for, and how to prevent damage to your eyes, including how to get a diabetes eye check. Now, if you've already seen the video that's coming out, you actually see me going through the whole process, and I want to tell you, hand on heart, it's an easy process, and it's so important to get yourself tested, get yourself screened, so that people can keep an eye out on your eye health. Plus, tonight we look forward to answering your questions. As well as mentioned, I've got the computer set up here, and it is lovely to see many of you already on the chat. Please say hello, please share your comments and your questions in that feed, and I'll make sure that the right people get the right questions. So we're going to cut straight to the questions that have already been pre-sent in to us tonight. And tonight I'm starting with you, Philip, over on the couch. My first, I want to say my first victim, but no, it's all very calm. I'll be very gentle. Now, first of all, it's great to have you on the couch. You're an experienced optometrist. You've got a bachelor in optometry from Auckland University.
Yes,
Kia ora to you.
Yes.
And you've worked in the UK, Zimbabwe, and you're an optometrist director at Specsavers Newland,
that's right.
Here in Auckland,
Yes.
one of the 58 stores across in New Zealand. So kia ora, welcome.
Thank you. Kia ora to you.
So, big question, and probably
Yes.
one of the most important ones that we see over and over again. What does an optometrist do?
All right. So back to
Easy.
the basics.
Easy.
Well, it's funny. You just do this every day, so you don't really think about it so much, I suppose. I mean, I think most people probably think that the optometrist is just about going to get the glasses. Yeah, so that's probably the first thing that people think about. So eye test, getting some spectacles, so you can see properly. That's probably the first thing they do. But contact lenses, of course, a lot of that.
Yes.
Okay, all right. And then optometrists can do the dispensing of glasses as well. But then there's the eye health part of it as well. Okay, so that's where the checking for things like looking for changes related to diabetes, for example, glaucoma screening, macular degeneration. We have equipment that measures the pressure inside your eye, does scans and photographs of the back of your eye. So there's quite a lot to it that perhaps people don't really expect, So we often take a really quite detailed history when people come in. So they're a bit surprised when I might ask them about their medication, for example.
Yes. Yep.
Okay. And whether or not they've got diabetes is one of the most important questions that we will always ask in history as well. So it's the optometry is a broad, as a broad sort of coverage, if you like, in terms of eyes. There's also the ability for some, there's diagnosis of issues around sort of, diabetic issues or glaucoma related issues, and in some cases also management of those conditions as well.
Right.
Yeah.
Right.
Yeah.
Now, one of the things that came up when we were filming this month's Diabetes Eye Check video, one of the questions that came up was the fact that a lot of people, including myself who have been through this whole process too, can get quite nervous about coming to an optometrist.
Right, yes.
So, as an optometrist, dealing with people like that, and again, I've experienced this myself, what do you do to help ensure people feel calm and okay about going through that process?
Yes, I mean, I think it starts at the beginning. You know, when you come into the store, you know, it's like that's what you do with training your staff, because of course the staff are the people that see you first when you come up to the reception desk. You know, so it's about them being friendly and welcoming. They introduce themselves, you know, take them through the procedures, explain to them exactly what's going to happen, you know, whether that's the pre-testing part of the eye test, you know, taking their glasses and measuring them, or whatever it happens to be. It's just explanation, okay? And then when they come through to see me, for example, you know, introducing myself I think helps a bit, you know, okay, so they know who I am.
Yes.
Okay, and then just starting off with some basic questions for people. You know, and some people definitely just flood up and they go, look, I'm a bit nervous about this.
Yes.
You know, and I just go, look, there's nothing to be nervous about. Any questions, just ask it. You know, just ask away.
Brilliant.
It's completely fine. You know, and I think that generally puts people at their ease.
Absolutely.
Yeah.
I had my eyes tested at Specsavers and I had an amazing
Good.
experience.
I had exactly that experience.
Pardon me?
Exactly that
There you
experience.
go.
So
Yeah.
good.
And I was pretty nervous, I'm not going to lie.
Right.
So it was amazing. All right, thank you so much
That's
for
right.
that.
Yeah.
Right, next up on the couch, David, it's your turn.
No.
Now, I've got here, you've got quite the history. You graduated from Sheffield Medical School in the UK.
Correct.
In 95. You completed your general ophthalmology training in South Yorkshire before embarking on a series of UK and overseas subspecialty fellowships in the field of medical retina. That's just incredible. Now, you've been here in New Zealand since 2005 and you've been employed as a consultant ophthalmologist at Green Lane Hospital, specialising in the management of retinovascular and macular disease since 2009. And you also hold an honorary position with the University of Auckland until recently you were the lead ophthalmologist for the Auckland Diabetic Eye Screening Service. By the sounds of it, you know a thing or two about eyes. So I have some really important questions for you. Again, these have been submitted. And one of the big questions is always, what's the difference between an optometrist and an ophthalmologist? So let's just start there.
Yes, so an ophthalmologist, we are medical doctors who specialised in the management and diagnosis of eye disease. So essentially, where Philip finishes, we start when it comes with the diagnosis of eye disease. So many patients, so their first interaction will be with the optometrist, and for many people that's all they need. The optometrist is there doing the basic health screening, surveillance, and even a relatively low grade disease that can be managed quite comfortably within our optometry services here in New Zealand. But when it gets to a point where patients have got disease which is either impacting their general health, or they've got specific ocular disease which is going to affect their vision, and that's when they often come to see the likes of myself.
Right. So big question too that's come through. How can diabetes affect your eyes? You've mentioned a couple of conditions. And obviously the big one that people want to know is, can diabetes cause vision loss? So 2 parts to that question that came through.
So the first part of the answering the second one is, can diabetes cause vision loss? Yes, it can. It's actually a small minority of patients who do get the very severe disease, but I don't want to underplay it. So diabetes can affect vision in 2 ways. One is through the normal things that people get, cataract, for example.
Right.
So cataract is more common in people with diabetes, and it tends to happen earlier in people with diabetes. And that's the one which will often take people to see Philip, because they're just aware their vision's changing, or if they're seeing people like Philip already, they would be monitoring for cataract and just notice that's changed. So most people are concerned that their vision's changing. It might be because of, oh my goodness me, I'm getting some of these bad things due to diabetes. Often it's not. Often it's a very simple thing. They just need glasses, or maybe they need a cataract looking at.
Right.
The second thing is the diabetes-associated changes that we see, and that's diabetic retinopathy. So that's when the diabetes is affecting the the retina, the film at the back of the eye.
Gotcha. So I understand that difference too. And I was just noticed out of the corner of my eye, we've had a question come through from Nishi in the live stream feed. It's a question for Philip. Do all optometrists know what to look for when it comes to diabetes?
Yes, absolutely. I mean, there's a few things that often happen with people when they come with diabetes. For instance, if they've just been recently diagnosed, it's not uncommon for them to have a bit of a shift in their prescription. So the power of their glasses changes. Okay, and so we're always, if we know someone's just recently been diagnosed with diabetes and been put on medication, we're unlikely to change their glasses at that point, because that can then revert back again.
Wow.
Okay, so that's one of the things you'd look out for. Any big change in their prescription, you'd be saying, but we won't do this yet because you've just been diagnosed with diabetes and you've just started medication. So we'll be waiting to see just until we get everything settled, and then we'll come back and we'll check it again. So that's an interesting thing just for people who are just new to it, for example, you know. And of course, we always are looking at the back of the eye for changes related to diabetes. The same sort of thing that David was saying. Okay, I suppose we spend a lot more time looking at stuff that looks pretty normal, and he spends a lot more time looking at stuff that's probably not very normal.
Correct.
You know?
Gotcha.
You know, yeah. So we're just looking out for those abnormalities. Okay, and then at that point, when we think it's necessary, we normally will send some information, exactly, and do a referral through to an ophthalmologist in the public or the private system, depending what the patient wants
Excellent.
to do. Yeah.
And I want to say thank you to Nishi for sending that question through. Please keep your questions coming through.
Yeah,
That's what these chats are all about tonight.
Yes, good question.
And also too, what I heard from that point was that it is a journey when you're working with any of your health practitioners. And that does remind me if you get a chance, please download the My Diabetes Journey app. We've got a screen coming up very shortly to show you what that looks like. You can get that on Google Play or in the App Store. And what that does is it gives you ideas around nutrition, and it's a way for you to be able to make a note of those symptoms or changes that you might be experiencing, and some ideas on well-being and wellness as well. Right, my next question actually comes to our third guest who's been sitting very patiently on the couch, and that's to lovely Liz Dutton. Now, Liz, you are the head of clinical services at Diabetes New Zealand. Always a joy to have you here. And you work in head office in Wellington, and you're a former clinical nurse specialist in diabetes with extensive knowledge and skills, and you're a valuable asset to Diabetes New Zealand as well as a clinical advisor. Now, Liz, you're on the phones as well. When people call up 0800, the 0800 diabetes
One
number.
of my many jobs.
Wow, you're a woman of many talents. Now, first of all, because you are dealing with people all of the time, Liz, what are the symptoms that people should be looking out for? Let's go back to grassroots. What are the symptoms people should be looking out for when it comes to diabetes?
Sure. I think here we're talking primarily about symptoms that can happen between screening tests. I think ideally people have their screening test done every 2 years at least. And symptoms can happen in between those screening tests, and it's really important to be mindful of what they can be, as you say. So things like blurry eyesight. It's interesting what Philip just said, actually. Just now about people who are newly diagnosed, and it can also happen when you've had diabetes for a while. If you have high blood glucose levels, what actually happens to the eye is the glucose goes into the lens of the eye, and it changes the shape of the lens of the eye. And so because of that, people think, I need to go and see the optometrist and get a new prescription for glasses. But actually, once, as Philip also said, they get the treatment right, the blood glucose levels come down, then the glucose comes back out of the lens of the eye, and the lens returns to the normal shape. So that is why it's reversible, as Philip was talking about. The other thing about that is that obviously there could be something else going on. So you do need to be mindful that just because you may have some, or you may be aware that you have high blood glucose levels than normal, there could be something else going on, so you should get checked anyway. You should see your doctor.
Come and have that eye test.
Absolutely, yeah.
Wow.
Another thing that can happen, you might just be sitting reading a book and then suddenly you're thinking, my eyes just don't feel right. It just doesn't feel like it usually does when I'm reading a book. So, don't just sit on that. Actually, it's always wise to get it checked. Then, of course, you've got double vision. Now, that's most people will probably feel like that's a bit odd. Double vision, obviously, should be checked straight away. And then you have things like maybe you might suddenly notice a bit of pain in one or both of your eyes. Well, pain is not normal, so therefore you should get that checked. And again, pressure is another one. So David talked about glaucoma before, but some people can sense a bit of strangeness around the eye, maybe a bit of pressure, and so again, get checked. And then you've got sometimes people get like these spots or floaters, and it kind of comes across your vision. The floaters often move, but you might notice some spots suddenly. Well, that's a most definite need to go and see an optometrist to make sure there's nothing going on.
One of the most common things we do at that point, of course, is and they will do this as well, but because they're more likely to come to us for that sort of thing, is dilate your eyes.
Right.
So it's kind of one of the things that happens with a lot of diabetics. So you'll have them, and if they haven't had their retinal screening done in the last sort of 12 months, for example, or 12 to 18 months, then we'll often do a dilation for them.
Right.
Okay. So that's good to have a look at things like the symptoms that Liz is talking about.
Yes, of
but
course.
just gives us a much better view of the back of the eye.
And I know one of the questions that actually came through is when they dilate your pupils, is it painful? Because this is what I'm finding a lot of people have been asking for. And having seen people go through this, and they're saying, no, it's just a little bit weird because your eyes are a bit more light sensitive. Sorry, you were going to jump in there, Liz, as well?
Yeah, I was going to say there was the one other thing I think we mustn't forget as well is some people also find some, maybe their sight is changing on the outside of their vision.
Oh, right.
That's why I know at Specsavers they routinely check field of vision, and that actually shows how wide your picture is, basically.
Wow. Wow. I know we've just had another question come through from social media. This is from Stephanie. Stephanie, thank you so much for your question. The question is, why does it take 2 years after diagnosis before screening is done for things like eye tests? Liz, you look like you've got an answer for that one.
Well, yeah, I was going to say actually it shouldn't be. If you've got type 2 diabetes, you should actually get your retinal screening done straight away because it's like a baseline.
Gotcha.
But for people with type 1, it's generally recommended 5 years because we know that with type 1, you will own that is when you've actually been diagnosed. Whereas like with people with type 2, they may have actually had it for a year or so. They just don't know they've had it for a year or so, which is why they actually need to get it done as a baseline straight away. But for people with type 1, because we know they've only just been diagnosed, it actually will take a number of years before there are any changes. Yes. So general guidelines are for someone with type 1, you'd wait 5 years. But for someone with type 2, it should be done straight away.
Thank you so much for that update, and I hope, Stephanie, that answers your question. Thank you so much. Now, if you have just joined us, kia ora and welcome. Ko Monique Bradley tōku ingoa. I'm Monique Bradley. Welcome to this Diabetes Action Month live stream, a really important topic, very dear to my heart. In fact, many years ago, my father actually lost his vision with undiagnosed type 2 diabetes. So that's why I'm here championing the cause, because it is such an important topic. And tonight, if you do have any questions, please feel free to share them on whatever Facebook page you're watching on. Share your comments or your questions in the feed, and I will do my very best to share those with our panel of experts on the couch tonight. Now, Dr. David, I wanted to ask you a question which is quite common. You mentioned common for us because we're hearing this all the time. You mentioned a couple of conditions, but I know that there are a number of different conditions that can be a response of something that happens for somebody living with diabetes. What are those conditions and what should people be looking out for? I know there's a raft of them, but the most common ones.
The most common would be cataract, and I suppose cataract and dry eyes. I think those are the commonest symptoms that people present with diabetes. Both of those conditions that optometrists are very capable of assessing for patients and managing up to a point. And particularly cataract, it gets to a point where glasses are no longer going to be beneficial, or they're uneconomical to replace them. That's when they come to see us. So those are the common symptom ones, I would say. The ones which are more worrisome are the ones like diabetic retinopathy and diabetic maculopathy, where the patient will be utterly symptomless until such point as, like your father, suddenly they've got a problem. And so I think I wanted to reiterate and say, it's not just, oh, I've got no problems, therefore I'm fine, because sometimes I think people think that, oh, I've not been checked, but I've got no problems, I'm fine. And I want to just really reiterate that you can actually have problems and not know about it. And that's that retinopathy.
Gotcha. Another question. Kat asks, how do you get rid of blurred vision if your blood sugar goes up? Do I start with you on that one, Liz? Great question.
It is a great question. It's all those good things that we talk about a lot. Healthy lifestyles. So thinking about is there anything I've actually changed recently? For example, have I been out? Have I changed my habits with my eating? Did I get sick for a couple of weeks, not done any physical activity? And so when you're sick, your blood glucose levels can go up. When you're not doing your usual physical activity, it can go up. Thinking about what you've eaten, has that changed at all in the last wee while? All those good things, the healthy lifestyle stuff, certainly for people with type 2 diabetes. With type 1 diabetes particularly, perhaps, maybe actually medication needs to change some way. That could be the same with type 2 as well. So it's about sometimes initially thinking about reflecting on is there anything that I've done differently? If there's not, it could simply be that things need to change, like you need to be reviewed by your doctor to have medication changed or start medication or something. But if you can think of, put your finger on something that has changed in the last few weeks, then maybe that's the point to start.
Very, very good point. Now, I have a question, because I know that a lot of the people that watch these live streams, they have family members who are living with diabetes, but they may be like me, high risk. And so in that instance, should I also be doing things like obviously living well as well as I can, but should I also be getting screened is that important for other family members too, as a early detection or awareness of potential challenges?
Well, so you're talking about retinal screening, or you're talking about? Oh no, the retinal. Regular eye tests. Absolutely, that's all you need to do.
Okay,
Just make sure you're having a regular eye test with your optometrist. Every couple of years. That's a really good screening in terms of that. Any changes. It would be unusual for us to pick up someone who's diabetic from an eye test. It doesn't normally happen, okay? So, but I have had it happen for sure.
Wow.
Okay, that would I say, well, there's changes at the back of your eye. Are you on any medication, or have you had a test for diabetes? And someone says no, and then we know, right, so off to the GP and get those things checked.
Wow.
Your cardiovascular stuff and your diabetic things as well, sugar levels to be checked, So, but you won't be eligible to do retinal screening through the diabetic service, of course, if you're not diabetic.
Of course,
yes, But the regular eye test is the thing.
Is the most important thing. And again, too, encouraging family members to download the My Diabetes app. I think
and we always
really
ask, if you've got a family history of diabetes, and we're interested in those type 2 diabetics particularly, in the family, because a lot of people say, oh no, they'll go like, oh, it's only type 2. A lot of people will say it's only type 2, and I go, well, actually, that's the one I'm really interested in, because that's the one that's more likely to run in your family.
Wow, so interesting. Dr. Dave, another question for you, which came in. What happens if any issues are found during or after the eye check? So you're noticing changes, or you've seen things. What is that process like for someone?
It really depends on the extent of the changes. So what we're looking at in screening is we're looking to say, is the retina normal, or are there changes there consistent with diabetes? The vast majority, it will be normal. there'll be a small proportion, about 30% of people will have some evidence of retinopathy if they've been living with diabetes for a number of years. And then we're classifying those, and so our job is to say, and Philip's job as well, is to say, okay, what level of retinopathy have you got? And we classify it with this classification of mild, moderate, severe, not. And we'll put that into that classification. If you're mild, then actually that's okay. That's probably an alert to go back to the GP and say, I didn't have any last time, I've got some this time.
Right.
Maybe my diabetes needs to be looked at. Maybe I need to check and see if I've got other complications of diabetes. But from my perspective, I won't see those patients because they're not sight-threatening. So when that level of retinopathy gets higher, even then you may be screen positive, being referred to see me from the screening program, but the vast majority of those will still not have sight-threatening disease. They'll have disease which is getting to a point where they're at higher risk.
Right.
And so they come into a higher level of surveillance. So I suppose there's this group of patients who come into the eye clinic and we don't necessarily going to have to treat them anytime soon, but we need to follow them up a little bit more closely and with different equipment than is available in the optometry service.
Gotcha.
And then there's this very small proportion of patients who actually have problems going on that we have to treat either with laser or injections or various other treatments. And then there is the very occasional person who, perhaps like your father, who will come first into the eye service, I've lost my vision last night, what happened? And they will need often quite extensive surgeries.
Thank you so much for talking us through that really important information. Now we have had another question come through as well. A great question. Is pixelated vision caused by diabetes? Wow, that's such a big question. I've never heard of pixelated vision before. I'll throw that one to you, Dr. David.
You probably hear this one too. That's a great question. Thank you, Rob.
Speak about that.
No,
wow.
Pixelated vision, in the context of diabetes, in my experience, is when people are getting hypo.
Wow.
So when their blood sugar is getting very low, their vision can do all sorts of peculiar things. And in fact, for a number of my patients, that if their vision changes, they notice is the first indication they're becoming hypo. So that's one indication. But many people will get other forms of pixelated vision. Migraine would be another one, for example. That'd be a classic one.
I know of it for migraines. Yes.
You do get these odd phenomena called visual snow that sometimes can get these phenomena. I would say if you've got pixelated vision, if you're not known to have diabetes, then a pop to visit your optometrist. If you have got pixelated vision, you know you've got diabetes, check your sugars. I suspect you'll find your sugars are a bit low.
Wow, that's incredible, amazing. Thank you for that question, by the way. Absolutely fantastic to have you on the stream. Joanne has just sent in another great question. Joanne, thank you. When should eye screening begin with a 4-year-old with type 1? Joanne, thank you so much for your question. We really appreciate you being part of tonight's chat. So where do we start with this?
Yeah.
Great
David
question. David?
Yeah, so that's always, particularly from any parent with any child, any diabetes is a problem or a concern, isn't it? And certainly one of the biggest concerns is my child going to lose their vision as a result of this?
Yes.
Typically, though, for type 1 diabetes, regardless of what age, you don't have retinopathy or vision problems from day one. Retinopathy is a disease of duration of diabetes. So the longer you've lived with diabetes, the more likely you are to have retinopathy. So at the age of 4, first diagnosis, you won't have any retinopathy. So we typically start screening children about the age of 11. So that will be the first screen. So being diagnosed at 4, we'd screen at 11. And then we would usually screen about the age of 14, depending on the sugar levels and depending on the type of the diabetes. So we would usually screen at 11, then at 14, and then every year or two, depending on the diabetes status at that point.
Thank you so much. Now, Liz, with your Diabetes New Zealand hat on, for parents who are looking after and loving their beautiful children who are living with diabetes as well, are there resources available through Diabetes New Zealand that can help support them through management of diabetes? I assume there are. Tell us about those resources.
Absolutely. When the children are first diagnosed, we provide a free, what we call type 1 pack, and it's got a load of resources. And in fact, there's a manual there for parents, and they pretty much call it their Bible because it has everything in it that they can learn. To learn how to keep their child healthy, And we also have Jerry the Bear. available. Now, Jerry is a soft, cuddly bear about this big, and he comes with an app on a smartphone, and you can feed Jerry a certain amount of carbohydrates. You can check his blood glucose. You can give him insulin injections. You can even put a pump on him, insulin pump on him. And the kids love Jerry the bear because they take him everywhere. You know?
What a beautiful connection, tool of connection, and to normalise that as well.
Absolutely,
How wonderful. And there's support for parents as well through the Diabetes New Zealand. Is there a support network specifically?
There is. We've actually, in the last couple of years, we've established kind of Diabetes New Zealand Youth. We've got a number of coordinators around the country, and that team is growing very fast, which is great to see. So there's a lot of local support now. In areas where there wasn't before. So certainly this year it's expanded considerably.
Wow, that's amazing. Great to hear, great to hear. Now my next question that came through prior to the broadcast is actually, I'll throw that to you, Philip. We were talking earlier about the ability with good blood glucose management to actually look at reversing some damage perhaps to the lens in the eye. So my next question to you around that is, what steps can be taken to prevent damage to the eyes?
Well, I think, everyone, it's the same question, isn't it, for everyone who's diabetic. We just talk about, in an eye test, you don't talk about it so much, I suppose, but always talk to people about diet and exercise.
Yes.
And almost everybody actually who's diabetic, who's already been diagnosed, knows that. It's like, I'm not telling them anything new, generally, So, obviously, diet and exercise, anything that maintains your blood sugar at a consistent and the level, the one that actually you're aiming to be at, is going to reduce the possibility, I suppose, of those changes that David was talking about.
Excellent.
So, but that's the same for all of us, isn't it, bit of good diet and a bit of exercise, and
it all helps.
Yeah,
it
exactly,
helps.
and it really does help.
So it's about maintaining that quality of life to get the best
absolutely.
wellness results.
And it's not always easy to do. I understand, we understand that, but a little bit is better than doing nothing.
Excellent. I love that. That's my mantra for tonight. I'm taking that one home. All right, so next question coming up. Again, thank you to all of you for sending your questions. It's so lovely. So many questions coming through in the live stream feed. Here's a great question. Is an eye test any different for someone with diabetes? A great question, Philip.
Mostly no. Okay, mostly we do a full eye test on everybody, a full eye examination. And it'll come up in the history that the person is diabetic, So, and then we'll be looking out for any changes related to diabetes. And if necessary, there might be some extra tests like a dilation appointment, putting some drops in and making the pupils bigger so we get a better view of the back of the eye that we might decide to do either then or even at a later date. So you go through pretty much the same thing as everybody else will go through, And many, of course, diabetics are also doing retinal screening. Yeah.
Wow.
So we're doing so. I always like to think that if the person's registered for retinal screening and is going, that they maybe are doing that every 2 years and then doing their eye tests on the alternate years in between.
Gotcha. So it's about that good management and keeping consistent. Again, one of the things I've heard tonight is it is a journey, and you've got to just keep on that journey of your eating well and exercising, and also checking in on your eye health. Yeah. Again, thank you so much. Thank you so much to everybody in the live stream feed. Yes, Karen Reid just said, yes, being proactive and making sure you are referred for screening on a regular basis. So people are thank you to everyone on the feed for sharing your feedback as well. Nishi just said, I didn't know screening could begin so young. So great to hear that information getting through. Wow, so many great questions. Keep your comments coming through as well. And if you've had an amazing experience on your diabetes eye health journey as well, please, we want to really demystify it for people who are maybe a little bit apprehensive about getting it done. In the latest video that's gone out through Diabetes Action Month, you actually see me going through the process. Now, I'm pretty nervous, to be fair, at the best of times, and I coped. And it was easy. So I really, really want to encourage you, if you are living with diabetes or you've got friends or whānau living with diabetes, please encourage them or encourage yourself to get your eyes checked. It is an easy process. And if I can giggle and laugh the whole way through, thanks to the amazing team at Specsavers who make you feel really good, then you can do it too. All right, next question. Here we go. Okay, Liz. Where should people go, people with diabetes, go for more information and support? It doesn't get much easier than that for you.
Doesn't get much easier than that, does it? No. Diabetes New Zealand. So what do we offer? We have an 0800 number. I'm not sure whether or not you've put that up anywhere at all. But
yep, it's up on the screen. You can see on the bottom of the screen there.
Awesome. And of course our website has a lot of information on it. We also have a website this month, diabetesactionmonth.org.nz, that's got a lot of really useful resources on it, particularly about eye health, as that is our topic this month. Then of course we do have, and you can find out where all your local supports are. If you visit our website, there's a section that says where are we, and if you click on that, you'll find all the various coordinators, or the youth coordinators, or the diabetes community coordinators that I manage, the Māori and the Pacifica, who are working in the communities in the various parts of the country, and a number of our other branches as well. Yeah. So there's a lot of on-the-ground support, much more now than we had previously. Of course, we've got all our pamphlets still available. You can order those just by calling or emailing our info@diabetes.org.nz email address, or just phoning and asking. But pick up the phone and ring the 0800 number 342 238, and we'll be able to put you in the right direction.
I love that. I love that. I've had a great question come through from somebody called Duchesne. I hope I said that correctly. Who's saying, you guys are awesome. I've got two questions. Philip, question for you. What does diabetes look like in the back of the eye? Can you tell if somebody, can you see something different that might indicate? I know we mentioned, we were talking about it earlier, that you see changes.
Some little changes, and the changes tend to be, and this is where David also does the same thing.
That's right.
But we're looking at, well, everyone probably knows who's diabetic, that diabetes affects the small blood vessels in your body the most, okay, and so that's your eyes and also your kidneys. So those little blood vessels can become sort of slightly thinner, if you like, okay, and they leak a little bit, okay, and you can see little wee hemorrhages, little dots of blood on the back of the eye, okay, where the vessels haven't maintained the blood within them, okay. So those are the first sort of often little changes that you get around the back, and there's certain little types that we look for specifically, you know. So that's sort of your beginning changes of the back of the eye, or the diabetic retinopathy, as people call it.
Wow, and Liz, is that sort of why you were talking about the floaters before? Is that something that somebody might see? Would it be that?
That's generally something slightly different.
Okay.
Yes, so it's not. Yes, this is not. The patient wouldn't be aware. The diabetic person is not aware that they're there. Okay, unless they happen to be very close to the centre of their vision. So that's why we were talking before when David said about people can have changes and not be aware of it.
That's amazing.
Yeah. So hence, again, we come back to it, don't we?
Yes.
Screening, eye tests.
Yep.
You know?
That's right.
Yeah.
Right.
That's
and again, a great question.
Yeah.
And yes, and following on from that, how do you know if a patient might have diabetic retinopathy? Throw that to you because it's come through again.
It's all about screening.
Screening. That's a clear message.
So that if you've got diabetes, you're eligible to a free diabetes eye screening test. Go and get enrolled. If you're not enrolled, if you haven't had it recently, contact your screening program or your GP. Some of our programs are still a little bit behind. You can take matters in your own hand and see people like Philip as well. That's okay for people sometimes within metropolitan areas where easy access to optometrists. Sometimes it's less easy out there in the other parts of the country, and that's where our screening programs have to be proactive and go out into some more rural areas. So it's all about screening.
Do the GPs automatically enrol people in the diabetic retinal screening
should.
program?
They should.
They
As soon as they're
should.
diagnosed,
As soon as they're diagnosed,
Yes,
they
that's what I
should.
thought. So you've
Yes,
just got to be proactive with the GP as well,
Yeah.
don't you?
absolutely.
Yeah.
Yeah.
I agree. So another question's just come through that we mentioned dry eye earlier. Dry eye was mentioned. What can be done to help prevent this, especially with more people looking at screens? That's a great question. Who is the best person to throw that one
We
to?
spend every day of our lives talking
That
about
would be
Wow,
Philip.
okay,
Yeah.
should we stop there?
Yeah. I mean, the thing is, well, it depends on what the cause of the dry eye is. I suppose that's what you're going to come back to for a start, you know. So some people do have like a deficiency in their tear film, you know, and we can talk to people about things to help with that, you know, different types of eye drops for different types of dry eye problems. But I suppose more specifically, if they're talking about screens, it's really quite interesting because when you're talking, like we are, for example, we probably blink about 20 times a minute, you know, every 3-4 seconds.
Now I'm consciously aware.
Yeah.
Like,
Yeah, exactly. When you're staring at a screen, probably about 3 times a minute. So if your eyes are going to dry out, that's going to be the time. So we have a little rule, which is kind of the 20-20-20 rule, which is every 20 minutes, look up from your screen at something 20 metres away for 20 seconds.
Writing that one
Okay,
down,
good.
20-20-20.
Easy one to remember.
I hope
Yeah.
I hope somebody who's monitoring the live stream feed actually puts that in as a comment. I think that's a great 20-20-20.
Yeah, so
writing
you
that
just
down.
blink, okay, and that helps your tear film, okay,
Wow.
and go back to the work. But we're seeing kids now with dry eye problems, you know, and it's as a result of screens.
Wow, great question, Joe. Amazing, that's fantastic. Another question coming in: how much does an eye test cost, and how does someone find out where to have a retinal screen? Obviously, we can't really talk about prices because every
Yeah.
optometrist is
It's
going to be
different
really
pricing,
different.
yes,
So
exactly.
we'll say to Shane, you can have a look around and find the best prices out. How does someone find out where to have a retinal screen? So who should I Liz, do I start that with you? If it's somebody who may be newly diagnosed or is living with diabetes already, do they come to you to find out those next steps around that?
I would be saying they should be talking to their GP first and foremost, because the GP should be aware of the service in their locality, and so they would know who actually has the contract from Te Whatu Ora to do that optometry, to do the retinal screening, so that it actually is free for someone with diabetes. You know, not all optometrists will do retinal screening free of charge for people with diabetes. There are those optometrists that are contracted to provide that service free of charge. So the GP really is the person who should know that in the locality.
Excellent, great, really great answer. Thank you so much. Through the Diabetes New Zealand website, though, as well, have you? Is there a directory? I need to check this out. Is there a directory to refer people to the right place, or straight through the GP?
It is, because the GP actually has to write a referral letter to
Right.
them.
Gotcha. Excellent, great question.
GP or nurse, of course.
GP yes, that's right. This is a great question, and this is quite a tricky one. So I might throw it your way, Dr. David. Is embryonic fluid in your eyes an issue for the long term? Have had this since birth. I've never heard of this.
Embryonic fluid. So we are born with a vitreous. So inside the eye, there's a vitreous gel. There's the cavity. And that gel formed in your mother's womb, and it's basically the scaffold that helps the eye form around the eye. In our youth or our infancy, it's a solid gel, and it liquefies as we get older. So that's the cause of the floaters, because it liquefies and the gel forms into little clumps and strands.
Wow.
That's the classical photos that a lot of people get. So that might be the embryonic gel they're talking about, but that gel water is replaced very frequently. So
Right.
you can get these embryonic remnants, which are little blood vessel remnants, which can stay in the back of the eye. So you can look at those in the embryonic blood vessels, which have persisted. That's not a problem with the vast majority of people, and those look very different from diabetes changes. So often we're very good at saying, no, that's a congenital, long-standing issue, the way your eye was built. This is an acquired problem from your diabetes, for example.
Wow. Wow. Again, I'm learning so much. I had no idea. Such a great question as well. And I think we've just got a couple more. People asking how long does it take to when you need to get laser treatment? That's a question that's come through. It can take a couple of years before laser. Is that something I can direct to you?
You can. So many people never need it.
Right.
It's all about your progression through the retinopathy, and how do you stop progression of retinopathy? It's all about maintaining blood sugar control, blood pressure control, regular screening.
Yes.
But some people, unfortunately, despite doing all the right things, can still run into problems, particularly our people living with type 1 diabetes.
Absolutely.
So it's often those patients would have been identified as high risk. They've probably spent a couple of years coming to see us, and we're going, yes, you've got some changes, but they're not too bad just yet. And eventually get to a threshold whereby we do need to start applying some treatment. So it's very variable, but it's often after a number of years.
Right. Excellent. Great response there. So good. And Diabetes New Zealand has just officially written in the chat, which I'm really happy about. Remember the 2020 rule, which I think is fantastic. Now, I am aware it's 7:45, so we've gone over our 30-minute live stream chat, but it's been such a great chat. If you could share, it's your Oprah moment now, if you could share one amazing piece of advice for anybody watching tonight, whether they are undiagnosed but they're experiencing some symptoms perhaps of diabetes, whether they know that they are type 1 or type 2, or they're noticing changes in their eyes, what would be the most important piece of advice you would share with them? Liz, I want to start with you.
I think call your doctor and get checked. It's simple to get a screening test for diabetes. Doesn't even need a GP. You could go to a nurse for that. And any of the above. If you notice any symptoms with your eyes, you should get it checked.
Right.
I would always say the one single thing not to do is do not hesitate.
Brilliant. Dr. David.
I would say from my perspective, it's all about screening. Screening. Get checked whether you feel you've got a problem or not. If you're living with diabetes, get checked regularly. Do not be afraid of what the results may be. The vast majority of time it's going to be reassuring. Even if it is a bad result, often it's not that bad. In that coming to see the likes of me doesn't mean to say you're imminently about to lose your eyesight. No, we are here to save your eyesight. We are here to protect it. So screening, and when you get invited to come to ophthalmology, don't run away scared, come.
I love that. Thank you so much. Yes. Philip, what's your advice?
Oh, I mean, that's all great advice. So, but I just say, look, take your symptoms seriously. Okay? I mean, and don't hesitate to do something about it. Whether it's seeing the GP, in your early diagnosis after you've been diagnosed as being diabetic, come and get your eyes tested and ensure that you're getting registered on the diabetic screening program. Excellent.
Thank you so much. Thank you so much. Well, we do have some final information for you tonight as well. Obviously, there's no doubt from tonight's chat that the consequences and from life, the consequences of losing your sight are far-reaching for those with diabetes, affecting everyday life, including your ability to even administer your own insulin, monitor your glucose meds, and of course check your feet or your skin for any issues. Now, while eye conditions, some of the conditions we've mentioned tonight, like cataracts or glaucoma and diabetic retinopathy, can lead to vision loss, as we've heard, early diagnosis, screening, treatment can go a long way towards protecting your eyesight. That's super important to remember. And if you are keen to learn more about taking care of your eye health, you can check out the Eyes on Diabetes video, which, as I mentioned earlier, I went through that whole process myself. It's not scary. You can watch that video and you can look at some amazing eye health resources on the Diabetes Action Month website. And if you need help or support, call Liz and the team, get in touch. We encourage you to call 0800 Diabetes to talk to the team at Diabetes New Zealand. They are an amazing group of humans who are here to support you through your journey. So you can also visit diabetes.org.nz for more helpful information. And of course, as I mentioned tonight, it is a journey. So download the free My Diabetes Journey app from the App Store or from the Google Play Store. And this is really your friend in your pocket that helps you with your nutrition, your activity, and of course your overall well-being. And it's a great way for you to start writing down any changes that you may be experiencing as well. It's really important to keep an eye on your well-being. See what I did there? Now, you can support Diabetes New Zealand as well this month through Diabetes Action Month by signing up for something really fun and amazing. It's Sneaker Friday, which is coming up on the 17th of November, where Diabetes New Zealand is encouraging all Kiwis to wear their sneakers to work, to school, or to play, to get active, to have fun, and promote something we heard about tonight, which is your overall health and well-being, your hauora. You've got to look after yourself and encourage everyone around you, your friends, your whānau, everybody at your workplace to do the same as well. So anyone who wants to be involved is encouraged to donate online, and you can do that on the website grassroots.com. Now finally, I don't know about you, but I have learnt a heap tonight, so I want to thank my lovely guests over here on the couch. Philip Walsh, thank you so much for joining us.
Welcome.
Lovely to have you here. Dr. David Squirrel,
Thank you.
Thank you so much. And of course, Liz Dutton from Diabetes New Zealand. Thank you so much to the three of you. It's been an absolute delight. And again, I've had so many mic drops and I've learnt so much from all of you. So thank you for the great work you do in our communities and for helping save people's sight. Thank you.
Thank you.
Thank you.
Well, I hope you've enjoyed that chat as much as I have. And remember, coming up on the 21st of November is our second live stream. And again, you get to be part of that conversation. So lock it in your diaries. Make sure you're following the Diabetes New Zealand Facebook page. And I look forward to sharing time and space with you again in our next Facebook feed. So time for us to head away. Please take care of yourself and your loved ones. You are important, you matter, and so does your sight. So time to head away. Ka kite anō e no hora. Ko Monique Bradley aho. I'm Monique Bradley. Thank you, and we'll see you next time.